Alrighty, so we are going to do a urinary catheter insertion for our patient. So previous to going in and doing the insertion, we've gone through the patient's chart. We've seen the order for the catheter that the provider has put in. So we have gone and gathered all of our correct materials. We've also made sure that the patient doesn't have any allergies to the materials that we're going to be using, as well as any contraindications, and we are all set to go there. So we have pre-medicated our patient about 30 minutes prior for the patient's comfort, and we've also provided peri-care, so the patient is clean and ready for their catheter insertion. Hi there, my name is Liz. I'm going to be your nurse. Today we are going to be doing a urinary catheter insertion that the provider has ordered, okay? Can you confirm your name and date of birth for me? Perfect, I've got the right patient. How are you feeling? Is the pain medication kind of kicking in at the moment? Perfect. So I'm going to perform hand hygiene, and we are going to provide privacy as well, and we'll bring the patient up to a position of comfort. So, alright. So I'm going to put some clean gloves on. And I would have wiped down my surface, let it dry completely so that I had a clean surface for my sterile field. Alright, so I'm putting some clean gloves on and we'll position our patient. So I'm going to expose you now, okay, and position you for that so that you're ready for the insertion, okay? Just let me know if you're feeling any discomfort. We'll keep you covered up as much as possible. Bend your knees. Okay. And we could also provide another blanket or towel or something on the lower extremities just so they're feeling a little more cover. So at this point, peri-care has already been done, so we're going to remove these, and hygiene, and we'll set up our sterile field. I'm going to put clean gloves back on, and we're going to set up this pad so that we can protect our bed sheets and things. Residual fluids. Tuck this. Okay. Now we're ready to set up our sterile field. Perform hand hygiene again. Okay. We're going to open this away from us.
Down, and then I can bring
That's a little garbage can for myself. Right there. Toss this. We don't
It's kind of in order. So like
Okay.
this is here.
So we'll open away.
Then this is here. Connect this. Use this. Then you're done with this tray.
You can put.
And then bring this.
You can put the swabs in that tray.
Oh, that's right. Yeah, you had it like this. Yeah. So then you're done with this, and then you take this.
Yeah. Just get the syringe out.
Alright. Put on my sterile gloves. So I'm gonna pinch here.
Yeah.
And then scoop.
They're long, they have long they go up here.
Alright, now I'm sterile. Alright, so this little pad we're not going to use, so I'm going to set that to the side. And we'll set up this guy for a sterile field at my working station. Shiny side down. set these things up here. Alrighty, so this is the lubricant that we would be using on maybe a real patient, but we're gonna use some Mani Lube instead. So I'm gonna set that to the side. And let's set up this.
Wait, is the stuff you used last time?
Toss that.
No, there's a can. It must be over.
Oh yeah, do you want that?
Yeah.
Put this in the corner here, and we're gonna lube with the Mani Lube. Set up our cleansing things here. That's nice and accessible for myself. And then we're making sure this is sterile water, so we're gonna hook this up to inflate our balloon when that time comes. Okay, now we are all set. Take this to the patient. I can place this on my sterile field that I have here. Alrighty, so you're gonna feel me clean first, and then we're gonna do the insertion, okay? At the point of insertion, if you can just bear down a little bit so that it can make the meatus a little easier to see for myself. Alright, here are my hands. I'm gonna spread. We're gonna do one wipe down one side and toss. One wipe down the other side and toss. One wipe down the middle and toss. Okay, now I can take my lubricated thingy and we're gonna go into the meatus, and we will see a flash of urine there, and then we'll insert a little bit further, and I'm going to hold that secure while I inflate my balloon. And then we'll detach this. We can toss that. And then we'll make sure that this is secure in the correct spot there. Toss that. And now I am done being sterile. So we'll hang this low. On the bed.
I will use this blanket to cover.
Make sure there are no kinks in there.
And then, is it okay for me
And we'll secure this. I could use a leg strap if those were available to me. We'll just use this clip for now. Okay, so let me get rid of all of this stuff. How are you feeling? I know it was a little uncomfortable, but now we are all done. I mean, I would dispose of all of this stuff. I'm going to put you back in a position of comfort here. Okay, get you covered back up. Make sure you're all comfortable. Got your call light within reach. I'm going to remove my gloves and toss them, but I'm going to see them. And move on to hand hygiene. Alright, so we're going to put our patient back in a low and locked position. Is there anything else I can do for you before I leave? No? Okay. Maybe another warm blanket? I'll do that for you. Okay. And then I would go and document my catheter insertion, and then we could reevaluate the patient in another 30 minutes or so, make sure that they're still comfortable and no pain, things like that.